Good morning, everybody. I am Dr. Vibha Kelashkar. I am from Jaipur. I am a gynecologist and I am an infertility specialist. I am from UP and I graduated from Meerut Medical College. And after that, I went to UK and I was abroad for 25 years and returned to India in 2006. Since then, I'm doing an IVF practice in Jaipur. Now, today I'm going to talk about infertility. And what is infertility? Infertility is failure to conceive within 1 year of unprotected regular sexual intercourse. Now, if after 1 year a couple has not been able to get pregnant, they should seek some medical advice. Most of the time in women less than 30 years of age, 60% will get pregnant within the first 6 months, and 85% will be pregnant by 1 year. But after 35, the rates go down, and 60% will get pregnant in 1 year, and about 85% will probably get pregnant within the next year. So, what are the causes of infertility? I won't talk about all the causes, but most commonly in the female, the causes are either tubal factors, where the fallopian tubes are blocked or damaged, or ovulation factors, in which polycystic ovary disease is a very common thing in India, endometriosis, fibroids, genital tuberculosis or pelvic inflammatory disease, and genetic factors. Now, there could be male factors also, in which they have men could have undescended testes, or they could have cryptorchidism, or they could have some other kind of oligospermia or azoospermia. Now, the most important thing is that the fertility is declining. As time is going, infertility rates are becoming higher and higher. And the most common cause in that is the advanced age of women who are trying to conceive. Now, if we know by physiology, women are born with an egg bank. When they are born, they have 1 million eggs, and by the time they attain puberty, there are only about 300,000 eggs left in their ovaries. And every month there is ovulation, and with them lots of eggs keep getting destroyed, they get wasted. And only about 300 eggs out of these 300,000 eggs are going to ovulate. Now this atresia, which we call, or wastage, continues even during pregnancy, even if you're taking the oral contraceptive pills, or if you are not trying for a pregnancy, this wastage will continue. And when there are only about 1,000 eggs left in the ovaries, then the girls will achieve menopause. Now, this decline of eggs is more after 30 years of age, and it starts getting very fast after 35 years of age. And along with the quantity of eggs, it's also the quality of eggs which is going to suffer, because there is DNA damage in the oocytes, and that's why the women who conceive after 35 years of age, they have lower chances of pregnancy, higher risk of abortions, and higher risk of having babies with congenital anomalies. And especially, you must have heard about Down syndrome. Those risks start getting more and more with advancing age. Now, there are tests. The number of eggs left in the ovaries is called Ovarian Reserve, and this is a very important factor in deciding whether what chances of success you're going to have with any kind of treatment. Now, this ovarian reserve can be tested by ultrasound, which is where you do an antral follicle count on the ovaries, or you can do AMH, anti-Mullerian hormone test, there's a blood test, or FSH, LH, that is follicular stimulating hormone, luteinizing hormone, estradiol levels, and inhibin levels in the blood. And these indicate, they will never tell you whether you will get pregnant or not, but they can tell you the chances of you conceiving. Now, the investigations, when do you start investigating? When do you start getting worried whether that you're not getting pregnant? If you're less than 30 years of age, you should wait for 1 year. If you're having regular unprotected intercourse, then you can wait for 1 year, and if you're still not able to get pregnant, you can consult a doctor. But if you're over the age of 35 and you've been trying only for 6 months and not got pregnant, you should consult a doctor. Or even if you're less than 30 and you have a history of some complications, like you've had pelvic inflammatory disease, or you've had an appendicitis with peritonitis, you have irregular periods, or if a man has problems like orchitis, pain or discharge, or some other problems, or history of undescended testes and surgery, or trauma to the scrotum, these people should seek medical advice earlier instead of waiting for the full 1 year. Now, what are the problems if you are more than 35 years of age? One thing is, as I said before, that you may not be able to get pregnant in time, and you may have abnormal babies, but that doesn't mean that you don't try for a pregnancy after 35. You should, one thing I would say to all the women is that they should try to plan pregnancy earlier and try to have the baby before 30 years of age, because after 30 years the chances become smaller and smaller. And even with assisted reproductive techniques, the success with IVF also after the age of 40 years is less than 10%. And after 45 it becomes less than 5%. So it's always better to try for a pregnancy earlier. Now people are going to say that we are going to have our careers, we are going to have our jobs, we have to settle down first before we have to have a baby. Yes, I agree with that. But this thing is also important. There are a lot of women who come, in fact in the West, more than 50% of the women attending an infertility clinic are more than 35 years of age. And there are a lot of techniques coming up which kind of tell people that, oh yes, we will go and do this and we'll get pregnant. But no, all these techniques are not 100% successful in these cases. There are limitations. Even with IVF, as I said, after 40 years of age, the success rate is less than 10%. So if you get pregnant, if you want to have a pregnancy, one thing is also very important, that you should go for a medical checkup and find out if you have any medical problems like hypertension, diabetes, or any other medical problems, because there are complications in pregnancy if you have these diseases, and it is also likely that you might develop these diseases during pregnancy. So again, it is important to have your pregnancies earlier. During pregnancy, there are tests which can be performed to diagnose any congenital anomalies in your baby, like you can have chorionic villus sampling or amniocentesis, or NIPT, which is a blood test to screen for abnormalities and congenital anomalies in the ultrasound examination. So you can have tests done, and it's very likely you would be able to find out if the baby is abnormal or not. But no test will tell you will make you 100% sure that the baby is normal till it is born. Then apart from this, apart from the medical complications and all these things, there are more obstetric complications also during childbirth if you are at an advanced age. Now, what I would suggest is try for a pregnancy early, plan your career, plan everything. But apart from this, it's also the society which has to make sure, and the administration has to make sure that there is support for girls who want to pursue their careers, who want to work, but also want to have a baby at the right time and also take care of it.